Thank you for having me. This is truly an honor. I'm Dr. Tamika Maxwell, and I work with Pediatric Associates of Lauderdale Lakes, and I'm a pediatrician.
Hi, my name is Tamelia Malcolm. I am a supervisor for the North Central Early Steps program. We cover 10 counties in the Alachua County or Gainesville area.
What developmental screening tools do you use in your practice?
We use 2 developmental screenings routinely. We have the PED screen, which is the parental evaluation for developmental status. And that gives us the parents' idea of what their concerns may be for their child or the status of their child developmentally. It touches on gross motor, fine motor, behavioral, as well as mental health. And it's about 10 open-ended questions. We do that at 9 months, 18 months, and 2.5 years. And then our second developmental screening is called the MCHAT. And that's a checklist for autism in toddlers. And that's a 20-question list that are more specific questions that's asking about the child's behavior, their interactions, and those are all yes or no questions. And that's done at 18 months and 2.5 years.
So at Early Steps, we use the Ages and Stages questionnaire, and we either provide that for the family to do on their own, or we facilitate that process by asking questions of the parent regarding the developmental skills that the child is able to complete.
Reach Out and Read providers also use books to help with screening and observation.
I'm proud to be a Reach Out and Read provider, and it has been a huge benefit in my practice. I've been practicing almost 17 years, and I was trained in Reach Out and Read in my residency and was so thrilled to be able to bring it into the practice here. And so Reach Out and Read provides books now down to birth, to 5 years of age, and each time the child comes in for a checkup, we provide a brand new book that's culturally appropriate to encourage not only reading in the family, but communication, language, conversation, and spending time with the child in a different way than a parent might usually. Reading books not only helps with language skills and speech, but also hand-eye coordination as they learn to turn pages, and also social cues as we're reading to them, the inflection of our voice. And so we use that as a tool also to see how the child is responding developmentally. And it can give a lot of cues. It can give some answers as to how the parent is currently interacting with the child. You can tell whether a child is used to having books read to them or not, depending on the age. How comfortable the parent is when you give them the book and when you give the child the book. Are they uninterested, or do they start to evaluate? Do they eat the book? Did they smile with the book? And so it's a really wonderful tool to help us kind of guide the parents in how to better encourage the child to learn how to speak, how to develop socially, and how to interact with the child. That really helps to bond the relationship between parent and child, which of course is going to be the groundwork for their skills and growth as they grow.
Here's what Cecilia, a mother in Miami, shared with us.
Gracias por escucharme. Les cuento brevemente cómo fue mi historia. Yo tengo una niña diagnosticada con autismo, retraso en el lenguaje e hipotonia. Como pasó todo fue que en un curso de Baby and Me yo me entero que Early Steps es una agencia que ayuda a los padres que tenemos preocupaciones para hacer screenings. Voy a hacer los screenings con mi hija. Pasó más o menos como 4 meses en ese transcurso de entender qué era lo que le pasaba, por qué no llegaba a los milestones, por qué no reaccionaba igual que otros niños. Y pues en el momento en el que ya me dieron la noticia, o vamos a decir que me intentaron decir que tenía autismo, se ponen 6 personas en un cuarto pequeño, nos encerramos todos, todo el mundo de pie, menos una señora que es la que me empieza a explicar lo que ellos vieron al final de todos los exámenes que hicieron. Y yo sentada y todos viéndome de pies a cabeza y pues me dicen, ¿verdad? Que ellos creen que ella tiene autismo, que ellos no me pueden diagnosticar porque no son los doctores, que tengo que buscar un pediatra especialista que ellos me recomiendan y que tengo que buscar un neurólogo para poder ya tener el diagnóstico y luego proceder a darle terapias, ¿verdad? Fue un momento pues difícil en el sentido de que yo no sabía qué esperar. Tampoco después de esos 2 pasos de buscar los profesionales y después darle terapias, no tenía más información de qué hacer, si alimentación de alguna manera, si otros exámenes, si había alguna escuela que yo pudiera ir con la nena. Así que me tocó madrugar, investigar porque tenía un trabajo full time, investigar muchísimo sobre qué tenía que hacer, cuáles son los siguientes pasos, que todo, imprimí muchos documentos, leí mucho, qué alimentación tenía que tener, cómo debía de transportarla, cómo debía de manejarme con ella, etcétera, con el objetivo de apoyarla. Entonces, después de todo eso, logré conseguir los diagnósticos. Tuve mucha persistencia porque me daban 6 meses para poder llegar a la primera cita con ambos especialistas y yo insistí tanto que a las 2-3 semanas ya estaba con cada uno de los especialistas obteniendo el diagnóstico. Así que esa es mi historia.
I just wanted you to know, that moment, just, hearing her story was so impactful, because unfortunately it is the story of many of our families. And although it's not intentional, this is a family that's in a very vulnerable space. So definitely we try not to have that many people in a room, because just having so many people in a room, it's already a very intimidating situation. It's sensitive information that's being shared with this parent. And so it should feel a little intimate, as opposed to having, 6, 7, 8 people in a room. But we do have to realize, this may be the thousandth time that we are saying this to a patient, but it's the first time that patient is actually hearing what's going on with their family, probably answering some questions that they had suspected in the past. So I would like to say she is correct, that Early Steps does not give out a diagnosis. However, I do want to point out that no matter if you have a diagnosis or not, the services that a child will need will remain the same. We don't service a diagnosis, we service a family and child. And so depending on where their skills need to be, improved, is how we support that family.
Well, first off, I agree with Tamelia. It's quite a fragile situation, and it really needs to be treated with gloved hands because it is so sensitive. And it's unfortunate, but a majority of parents and children are on wait lists, especially post-lockdown. In this COVID world, there's been a lot of facilities that have closed down, and those that are still open are now overrun with all of those that have delays, whether it be autism or a multitude of delays. And so kudos to her for being able to navigate through the system and get appointments sooner. And so I think what I would recommend to a lot of families and clinicians is to make it as concise as possible, to give them simple step-by-step, 1, 2, 3, what are going to be our first steps. And then you have a follow-up, pretty closely after you have that diagnosis, even if it's within a month to 2 months, so that you can touch base again. Because a lot of times once you send them away, again, they're overwhelmed. I think that those frequent touch points after a diagnosis of autism or another serious developmental delay or disability is really important. And so the care managers and case managers that are through Early Steps are huge. And I think that's probably the biggest missing piece in private practice.
Both parents and clinicians look to developmental milestones set by the CDC to guide them on children's healthy development. These milestones were changed in February 2022 for the first time in almost 20 years.
They're basically a guideline. They're a set of social, also motor, fine motor, meaning what you do with your fingers, or gross motor, like walking, running, and communicative milestones that can guide the clinician and guide the parent as to where the child falls on average. So when they were originally formed, they were based on where a child typically achieves with 50% of the population. So 50% of the time, a 4-month-old is going to be smiling and laughing and engaging by 4 months. And with the new changes with the milestones, they were adjusted to meet that measure for 75% of children. So instead of when the average or 50% of children meet that milestone, it's when 75% of children meet that milestone. It does have a bit of pushback with that, because if you can imagine now, some of the milestones, for example, especially with speech, prior to the change, it was expected that 50% of 2-year-olds are going to be speaking about 50 words by that milestone, by the age of 2. Now that milestone has been adjusted to when they're 2.5, 6 months later. 6 months is a huge period of time for little people. So it's kind of a balancing act in the sense that you want to make sure that you're catching things early on, but you also don't want to cause any added concern or stress to a family if a child isn't meeting a milestone, if they're really not expected to.
You know, it delays the early intervention process from taking place. And, you know, I know that the change was to prevent a wait and see, but it's almost like it's allowing for a wait and see in some instances, because if a child is not, you know, saying the number of words that you would expect them to say at 2 years old, we would have gotten that referral just a little bit sooner. And so even though we may catch them later, let's say, what that does for our program is that parents are no longer aware at an earlier time that early intervention even exists.
For many families, that intervention is critical. Here's what Kayla, a mother in Tallahassee, shared with us.
Hi, my name is Kayla. I have a daughter who is 4. When I was 3 days postpartum, I found out that she had a cleft palate. When she was 7 months old, I noticed she wasn't reaching for objects as if she couldn't see them, and I found out she had very poor vision. And then at the age of 1.5, she was diagnosed with Stickler syndrome, which is a connective tissue disorder. It is degenerative with the eyes, ears, and joints in her body. So I felt initial shock. I felt very lost because I was released from the hospital initially with very little resources. I felt overwhelmed. It's an overwhelming feeling not knowing if your child is going to develop as they should and where they will end up, how it will affect their life in being successful. And thankfully I was able to have amazing people in my life where I was able to get those resources. And I wish I could tell myself 4 years ago that it's going to be okay. And I just take things day by day now. But I definitely think that if I had more resources readily available to me, I wouldn't have felt so lost and scared initially with the shock of everything.
How do you make sure parents get the resources they need as early as possible?
I will tell you, here in North Central, we have a connection with the NICU, and we try to also increase our connections to all of our pediatricians and all of our offices in our 10-county area, because this is really important for families to be able to connect as soon as they're discharging, or, you know, they have their first visit with their pediatrician outside of the hospital. So we have a parent coaching model for those interventions, and that is to educate the family and to have them in the driver's seat of those intervention activities. And we're kind of sitting and coaching that family and making sure they know what they should be doing and how to perform certain skills with their child in their everyday life.
Are we doing enough to prioritize children and their families?
I don't think we're doing enough, no. And as I think through that and hear the stories, I think what would be really beneficial all around is to streamline the process. And I think if we were able to really just manage the resources better in a cleaner way, then that would help us facilitate what the patient and family needs better, and the whole experience that the family has would overall be a better experience, so that the child can, again, the end point is for them to get the services that they need.
Definitely, we need a coordinated team and some kind of way to connect all the resources together, because yes, whether it's funding for a specific program that's gone and no longer exists, or a program exists but they're no longer taking this insurance type or that, unfortunately we're navigating the system, and we're trying to navigate the system on behalf of the family.
If you had a magic wand, what is one thing you would change to improve early intervention for children and families?
If I had a magic wand, one thing I would change about early intervention for children and families who need it, I would say, is access. We serve families from, those that are in the city, but also those that are in the rural communities. And so they may travel or have to travel over an hour to get to a provider that will be able to see them, even after all of the, long wait lists and things like that. It's the the limited resources that are available to families out in rural counties. And it's not even just transportation, but even access to the internet.
Besides having that central resource that we spoke about before, which I think would be key, would be education. You don't know what you don't know. And I think if we were able to educate our parents in a more impactful way, that it really reaches home, it really resonates with them, so that we could again work as a team, and not just those single touch points when they see the pediatrician, or a friend at the park, or a teacher may see something. If parents were really able to be educated in a more comprehensive way.
For more information on early intervention and developmental milestones, visit CDC. Reach out and read. Help Me Grow Florida, Early Steps.